Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome to Physician Heal Thyself, the podcast. I'm your host, Dr. Lara. Have you ever experienced any digestive issues, maybe bloating, gassy, abdominal pain, diarrhea, constipation? Well, if that's been your history, you definitely want to listen to this episode. Today, I am interviewing a special guest. Her name is Dr. Skye Goldin. She's a naturopathic medical doctor and a fellow of the American Board of Naturopathic Gastroenterology. So I'm going to bring her on the call. Welcome, Dr. Tara Goldin.
Thank you.
Before we get started into our conversation, I want to just introduce you to our audience and just to share a little bit of your background. So Dr. Goldin is a registered naturopathic doctor in Colorado, and she is she's board certified in naturopathic gastroenterology. That's a long way of saying digestion is her passion and her specialty. Whether you're dealing with bloating, constipation, diarrhea, reflux, gas, or more complex issues like SIBO, which we're going to talk about today, IBS, celiac disease, or GERD, or any other inflammatory bowel disease, she's here to help you to get to the root of what's going on. Many of her patients come after years of frustration and treatment failure, and some have tried multiple Western medical doctors, while others have worked with naturopathic or functional medical practitioners, and they're still not getting the results they were hoping for. With over 35 years in practice, she specializes in helping people with complex, stubborn cases, finally experiencing meaningful breakthroughs and long-term healing. She listens deeply, investigates thoroughly, and uses a naturopathic approach that combines advanced testing, whole body wisdom, and a personalized natural care. Welcome, Dr. Tara. This is, I'm quite impressed with the work that you're doing. I have to be honest with you, Dr. Tara, I did not know that that the option to be board certified as a naturopathic gastroenterologist was even an option, but I know with our medicine, we continue to grow and advance and have, these kinds of certifications or board certifications. Share with our audience a little bit about what got you into doing this work in your practice.
Well, what got me here was probably my own health journey from very young. I always had digestive issues, and I spent a lot of my teens and 20s sort of trying to figure it out on my own. I became a vegetarian. I tried eating all the health food, and I got really interested in natural foods. I even at one point was baking my own bread, which made me worse because of gluten. But I was just trying to figure it out. And I was an environmental biology major in undergrad. And I kind of would get excited when I'd hear about how they used to use plants as medicine, back in, they do now, but it wasn't so much back then. And so something in me was just kind of leading me towards this holistic health journey. And just through lots of twists and turns, I ended up through naturopathic medical school up in Seattle at Boulder in the 1980s. And, all along I knew that I sort of came to the realization that if the gut is off, everything's going to be off. You're going to have more inflammation. You're going to have more brain fog. You're going to have more, your neurotransmitters are going to be messed up. So you're going to have sleep. You're going to have anxiety issues. You're going to have anxiety issues. So the gut just is it's like the second brain. Yes. So I came to that realization. I was a general naturopathic doctor for many years, and then I started specializing a few decades in. And then just kind of went in that direction and kind of just kind of became really nerding out
Nerdy
on
out,
just
yeah.
the gut. And then, and so that became my practice. And so
Wow.
that's sort of what brought me here.
Wow, amazing. It's always amazing how,
Yeah.
as naturopathic doctors, there's always like a personal journey and connection to what we end up getting into, right? That's
Yes.
awesome. What are some of the common, I know today's episode for our audience, we're going to talk about SIBO and what that is, but what are
Hmm.
some other very common digestive issues that you see as you work with patients?
A lot of GERD, a lot of gastroesophageal reflux. Um, here in Colorado where I live, it's not as dry as Arizona where you are, but it's pretty dry. And so there's a
Yeah.
lot of constipation,
Okay.
which could be C. methanogen overgrowth, which they used to call methane SIBO, but now it's IMO, intestinal
Yeah.
methanogen overgrowth. So there's a lot of that. I see inflammatory bowel disease as well.
Okay.
So really the gamut. If somebody's looking for a digestive specialist and they're looking for someone with more than naturopathic functional medicine, they often end up reaching out to me at that point.
Okay. Well, let's get into this conversation
Okay.
because I know you were excited and passionate to talk about SIBO. Why don't you share with
Hmm.
our audience what is SIBO, what does it stand for, and then what are some common symptoms that people can experience when they have this condition going on?
Sure. SIBO is small intestinal bacterial overgrowth. Um, and what happens is by one way or another, you get bacteria growing in the small intestine, and it could be part of your normal flora, but it's growing in a place where it normally should not because of motility issues, lots of reasons. And it can cause a lot of IBS symptoms. It can even contribute to a lot of GERD symptoms because of pressure on the lower esophageal sphincter. But you can have bloating, constipation, diarrhea, a mixture, gut pain. Really it can trigger the gamut because the bacteria is fermenting in the small intestine, producing gases, which can cause a lot of the symptoms.
What are some common trends, if you've caught any, that would contribute to, like, how do people get SIBO?
Number one cause is food poisoning. People get a bout of food poisoning, and the endotoxins from that bacteria that caused the food poisoning damage the nerves of the small intestine, which is called the migrating motor complex. Not to get too complex, but
Yeah.
once we lose the motility there, um, then bacteria can migrate or build up in the small intestine because it's not being moved through properly. So that's the number one cause. Other causes are traumatic brain injury,
Really?
hypothyroidism, abdominal surgeries. Let me see if I'm forgetting any. There can be a lot of causes. And also just exposure to more and more, I'm seeing exposure to farming chemicals as a contributory factor because the farming chemicals are going to damage the gut lining. And
Yeah.
basically, it boils down to damage to motility.
Yeah. Are you, like
So,
pesticides, some things like
yeah,
that?
pesticide, glyphosates, things like that.
Glyphosides. Okay.
Yeah, things like
That's
that.
interesting. You mentioned that traumatic brain injuries can
Hmm.
contribute to the cause of SIBO. How so? Is it because of the nervous system connection to the gut?
Exactly. The
Yeah.
gut-brain axis gets damaged. So, then there's just a lot of work to be done to get the neurological functioning working better.
Would you say that that could be even a case for people like children with high ACE scores, where there's been a lot of trauma, abuse in their life, and
I would
the
say, yeah,
yeah, yeah,
yeah, definitely. I think that trauma affects the immune system. It affects everything,
everything,
really.
yeah, wow,
So I definitely see people who've had a history of trauma in their childhood, they definitely have more chronic illness.
yeah,
And
it
it can
definitely,
it can it can like go in a lot of ways. It can manifest in a lot of ways, and definitely the gut. We store
the
a lot
gut,
of
Yeah.
emotions in our gut.
Emotions there. Yeah. I definitely see that in my practice. A lot of digestive issues, related to trauma. The bacteria overgrowth for our audience, is this good bacteria? Is this the bad bacteria that's overgrowing? Is it both?
It could be either.
It could be either.
It could
See,
be
I
either.
thought it was, honestly, because I do some digestive issues, but not big on SIBO. I
Uh-huh.
thought it was like bad bacteria overgrowth there. So
It
not
could be. It could be your
necessarily.
normal flora that migrates up through, ileocecal valve that's too lax,
Yeah.
and it's just in the wrong place because of motility, and then you start getting the symptoms.
So it's bacteria that could be in the wrong place.
Yeah, we're not
So,
supposed to have a lot of bacteria in our
yeah.
small intestine.
Yeah. So the common symptoms that you would see would be like the bloating, the constipation. What are some other rare symptoms that you've noticed can be caused from SIBO?
It could be a lot of diarrhea. It could be a mixture. It could be alternating. It could be esophageal pain and stomach pain because of the gas pressure in the lower esophageal sphincter. It can be, and just overall inflammation and anxiety because of the
Yeah.
neurotransmitters, the effects on neurotransmitters. And there's a statistic out there that I don't know how current this is, but recent one I heard that 85% of IBS cases are actually SIBO. So, but people don't get tested. They don't know. They go to the
Yeah.
doctor. They go to the regular Western gastroenterologist, and they say, "Oh, you just have IBS. Learn to live with it." Oh
Yeah.
well.
So
So,
how do you go about diagnosing and assessing for SIBO in
mhm,
comparison to what, a medical doctor, a gastroenterologist would do?
mhm.
How is your approach different? That way our audience knows, because I feel like a lot of people don't know what other
Right.
options are out there for testing, and there's so many great options. And you don't have to
Hmm.
name specific like lab companies or anything
Sure.
like that, but how do you go about assessing someone for this condition?
Well, the gold standard right now for SIBO testing is a 3-hour lactulose breath test. And I like the 3 hour because it takes it all the way down into the large intestine. And I like to see what methanogens are doing down there. So,
Wow.
so that's the gold standard. It's not a
What now?
perfect
What does that?
test.
What does that consist of? Because
Um,
this is new to me. I'll be honest. I'm
okay,
always honest and
sure.
transparent because that's not. I don't assess that way. But what does
Yeah,
that look like for this 3 hour? Is it? What is the process of
sure.
that?
The process
The
is
process.
you get a kit in the mail. Some places do it on site. More and more gastro offices are doing it. 2, 3 years ago, they weren't. They said SIBO's not a thing, but enough people ask for it, I guess. It's still not covered by insurance usually,
Yeah.
but so there's a prep diet the day before, and it's usually like eggs, rice, and chicken, or some combination thereof. Like if someone's vegetarian or vegan, it's going to be whatever it's going to be. And it's basically a super low fermenting diet. So the day before, that's all you eat. And then you fast overnight. And then the next morning, you take your baseline samples, and it's like you breathe into this little tube and it inflates this little bag. And they collect your samples. And then you drink this lactulose. They also have glucose and fructose ones, but I like lactulose the best.
Hmm.
Glucose gets used up or higher up, and so we don't get to see what's lower down. Fructose is a little harder to get here in the States. So they drink the lactulose and then they take breath samples, periodically to get to what I prefer. I prefer the 3 hour. They also have a 2 hour test. And what that does is it's going to measure the gases as to this lactulose, which is going to feed the bacteria and ferment it. It's going to measure what is those bacteria are releasing as they eat. And so we get a good reading. Now, if somebody has rapid transit time or super slow transit time, it can alter the test results. So it's not perfect, but it's the best we have at the moment. So I use it.
Wow. Wow.
When they come up with something better, I'll switch.
Yeah. Is there,
So
what's your take on some of these other specialty tests where they're doing like they're collecting the feces, right? And then they're looking
yeah,
at the bacteria, probiotics, viruses, any
that's
pathogen.
yeah. I love those, those tests for looking at the what's going on in the large intestine. It's not going to tell me what's going on in the small
Small
intestine.
intestine, yeah.
It's not accurate. It might be able to measure methanogens in the stool, so
Yeah.
you could tell that. But these tests that say, oh, this marker says SIBO in a stool test, it's like, what are they measuring? It's like they don't even say what they're measuring. They just have this thing that says, yes, we have SIBO. So I tend to not use them for
Okay.
that or see it as an accurate representation for SIBO testing. So,
Okay.
but sure, if it shows methanogens, I'll be like, okay, emo, they have intestinal methanogen overgrowth. But for SIBO, you really got to do a breath test.
Yeah. Are there any other tests besides that, or is that kind of like that's for
That's kind of the one, yeah.
okay. That and based like obviously the patient's history, how they
Yeah,
present. Yeah.
patient's history. Now, if I have somebody and they're like, I had food poisoning and I've never been well since, it's kind of like, okay, bingo. But I usually like to test. My patient population usually comes to me after they've been through the ringer with other practitioners. And so they usually come to me with a whole file of like fairly recent tests. So sometimes, in that case, I'll just go into treatment. But usually if they haven't had the testing, I like to get baseline numbers and just see what's happening.
Good. Okay. When so one I know I don't this episode these conversations are not to give advice, medical advice to our patients. So
Sure.
I just want to make sure that our audience knows that anything we share, it's we're just talking about the approach of how we would go about treating this. Nothing specifics. They would need to reach out to
Sure.
Dr. Tara if they wish to work with you and get more information. And we'll share your information as well. But this is more general. Obviously, we know that diet is going to be a huge component to helping someone heal with this. What are some other things that approaches that you tend to generally take on treating someone with SIBO?
Well, this is a whole antimicrobial approach. And what you're going to use as an antimicrobial varies. Like there's antibiotics, which generally don't work super well. They have like less than 1/3 success rate and then you tend to get a lot of recurrence. And the same actually goes for the herbal antimicrobials, which is, when people see functional medicine doctors, they're often they've done berberine, they've done neem, they've done oregano oil, they've done allicin, they've done, all the things that you think of for, SIBO. I've been working a lot with high dose sulfur in the past few years that I learned from Dr. Kathleen Janelle. And it's been working a lot. I would say maybe with antimicrobials, I would get like 60%. We'd have to kind of follow success. We'd have to kind of follow it up with more, like when they got a recurrence and manage that. And the high dose sulfur is working like I'd say 80%. Dr. Janelle says for her clientele, it's 90%. So
Oh, wow.
I'm kind of been enthusiastic about that, and it's been working for these really tough cases.
Those tough cases, yeah.
Yeah.
So when with the diet approach, are you also like just a lot of the fermented foods? It's a no, or
Yeah, I tend to I don't go super strict like low FODMAPs because that's really unsustainable for most
yeah,
people. And I really my aim is not to put people in food jail. Like because
yeah.
they're just like this
And they're
restrictive
miserable.
eating. They're miserable. They're eating 5 foods, maybe. Maybe
Yeah,
they're eating like chicken and green beans and rice, and that's like it's like
yeah.
all. Dr. Nerla Jacobi came up with a biphasic food plan, so I use that,
Okay.
as a template, and it gives a little more guideline. It's a little more liberal, like open
Yeah.
than the low FODMAPs food plan. And I'll just say that all that these food plans do is reduce symptoms. They don't cure the SIBO. So
That's good.
they
Yeah.
don't. So, but it gives the patient relief while they're waiting to get test results back, or while we're starting it helps them feel more comfortable in a lot of cases. But it's not the end all. And we don't
Yeah.
want people to have a lot of food fear or, get
Yeah.
super restrictive. And then, but then I kind of like reduce that to the most fermentable and inflammatory foods. So, but we really want people to have a wide variety of polyphenols from fruits and vegetables so that they can grow a good microbiome.
Yeah, it's really important too. I think people
Yeah.
forget that the polyphenols are not familiar with that. So for our audience, explain what polyphenols are, because I know I love to use them
Yes,
from
they're
our food, but even isolate it. Yeah.
they're chemicals, phytochemicals from fruits and vegetables,
Hmm.
basically. That's all
Yeah.
they are. And
Yeah.
different ones will feed different strains in the microbiome. So you need a
Hmm.
variety.
Yeah.
So the dangers of the restrictive eating when you're down to like just a few foods, over the long term, people
Yeah.
get sicker. Which is, I have some people coming to me and they're so sick that they've been on like carnivore for years, right?
Yeah.
You know.
So what's your take on that? Because that's the big hit right now. That's the trending thing. Everyone's
Yes,
on a
it's very
carnivore.
trendy, and I'm going to make a
Yeah.
lot of enemies today,
Yeah.
probably. But
It's okay,
um,
it's not.
I'll be controversial
Yeah,
here.
it's okay to
But
be controversial. People need to know the truth is, something
yes,
like that can be good temporary, but what's like your take on something
my
like on a
take.
carnivore diet that's long term? It's
Yeah, it's not good.
yeah,
Now, people love carnivore because all of a sudden their fermenting symptoms are gone, and they're like, "Wow!" And all of a sudden, some of their inflammation is gone, and they're like, "Wow! I feel my brain's clear, and my gut's better. I'm going to do this forever. I'm never going to eat any plants ever." And after a while, it breeds a ground for them to. It's a breeding ground for them to develop an increase in their hydrogen sulfide species. And these are species, I'm going to, technical here, Fusobacterium, Desulfovibrio, Klebsiella, those are all sulfur producers. And they can really mess with a person. They're inflammatory. They trigger IBS. So the people say, I did carnivore for like 5 years and I was great. And now I'm really not, great. But they're really scared to add in some fruits and vegetables. So
yeah,
I'm like, gosh, if someone's in that situation, I mean, just start adding in little blueberries. How about some avocado? You know, some of these lower fermenting fruits like the
yeah,
berries.
the
And
berries, yeah,
yeah, I wouldn't have them go out and eat a bowl of broccoli, maybe. That might make them feel like a little,
gross.
or onions and garlic. There's nothing wrong with those foods, nothing wrong with them. But for
Yeah,
someone who has a lot of bloating, they can be triggering.
yeah, they
So,
can.
so just like it's important to slowly increase the polyphenols,
Yeah,
or, so but they're so scared. People
yeah.
who've been on carnivore often are really frightened to introduce some new foods.
Yeah, I find that like with any of those extreme diets, right? Once they
Hmm.
lock into that, they think that's the way to go, even though they feel good initially. Over time, they may develop other conditions related
That's
to the
right.
diet. Yeah, is I
That's
mean,
right.
plants are part of our, of our environment. They're good for us to have, and for our audience to understand these polyphenol nutrients. They are like Dr. Tara said, they are compounds, chemical compounds in plants, and they protect the plants from from UV damage, any damage in their environment. So these compounds in the plants is what keeps the plant alive. And when we eat these foods, we're eating those same components to help our cells, to help us at the cell level to be healthy. So
Hmm.
it benefits us to eat food that is truly living, right?
Hmm.
Whether it's your plant, your vegetables, or your fruits. So they're very necessary. So to have a strict diet of completely nothing but meat, maybe for a couple months, but
Hmm.
long
Just to kind
term,
of settle things down,
yeah,
but long term, you're going to want to add some things. I'm not saying go out and eat a giant salad, raw,
right,
but
yeah.
just
Introduce it
just
into it slowly.
introduce and different ones.
Different ones, yeah. Because
Hmm.
otherwise your body will not, especially if you cut out those like the sulfur rich foods like the broccoli and the onions and the garlic, when you do start to eat them, your body reacts because you haven't ate those foods in a long time. Yeah. So so that's interesting that you're using, these therapies for SIBO. What is approximately about the time frame? Say you have a patient that, is compliant and they're doing everything as they should be. What's typically the time frame that you start to see their symptoms subside and get some deeper healing for them?
Typically, a course of treatment with me, typically at least 3 to 6 months.
Okay.
Sometimes after we do a whole protocol, I like to follow them up on a maintenance phase for a while, which can help prevent recurrence. And do they need motility agents and all kinds of things, that we have to evaluate. But sometimes people feel better quickly, and some people take longer. It depends.
Depends how
Yeah.
long they've probably been dealing with this too. The longer they've been
Yes,
dealing with it, the longer it'll take for them to heal.
absolutely.
Yeah.
And especially like these chronic cases, it can take the better part of a year for some of
Yeah.
these people. But
You mentioned motility agents. Are these like natural or are these pharmaceutical agents?
there's both. I tend to use
There's
the
both.
natural ones more.
Okay.
The natural ones contain a lot of ginger, artichoke, that kind of thing, which just help stimulate motility, which helps just kind of squeegee out the small intestines so we don't get overgrowth. And it can help a little bit with some cases of constipation or emo. So, but there are step up therapies with prescription things like Motegrity, domperidone, things like that. I tend to not use them a lot, except in severe cases. But because a lot of times the natural ones for a lot of people do well.
Yeah.
So,
So I'm curious, Dr. Tara, what is your take on these GLP-1 medications, semaglutide, whatever the other ones are that people are using off-label for weight loss? Because it has a
uh-huh.
huge impact on gut motility.
Yes.
And I feel like so many people, some of our colleagues in our industry are overlooking how serious this is causing an issue to our gut.
It's huge. It's really huge.
Please dive into it. Don't hold back. Just do it.
It's really really tricky because um, you know GLPs no doubt have benefit for these people who just cannot, no matter what they do, they cannot lose weight, and they have pre-diabetes or diabetes, you know and obesity and all kinds of cardiac and neurological. GLP-1s can be wonderful for just kind of moving that needle, but they also slow motility. So it kind of, people who do what I do, we really have to work hard to maintain motility.
Yeah.
So it's a heavy lift sometimes, because it's like, okay, what's the main limitation in their life? Is it their metabolic syndrome that's causing their illness? Is it the constant, so we have to manage the motility issues and the constipation and even the gastroparesis that can go along with it.
Yeah. Let's
And
talk about that in a way that, anyone can understand. What is gut motility? I mean, to
gut
us,
mo-
we know what
yeah,
that
we know
means,
what it
but what
is.
does it
It's
mean to you, others? Yeah.
There's a whole plexus of nerves in our gut that moves things through, moves the stool through, moves the chyme through in the small intestine. And is, it gets damaged by a lot of the things I mentioned. And then we end up with, people with chronic constipation or SIBO but it also, when the motility is low, it decreases the appetite because you feel full longer and you don't have that food noise. So people do the GLP-1, but that's motility. It's basically the plexus of nerves that moves stuff through.
Yeah.
And when that gets compromised, you get digestive problems.
Yeah.
So some people are more sensitive than others, and it's a real problem. So that's motility. And As we age, we lose motility. Exposure to farming chemicals affects motility, nerve damage, scar tissue in the abdomen from surgeries affects motility. Just lots of things. Oh, connective tissue disorders, another huge. People that have Ehlers-Danlos, they just don't have good connective tissue to be strong enough to really move stool through. So they're often have issues with motility.
So how many doctors do you think are taking into account a person's digestive system before they're putting them on these GLP-1 medications?
Well, I don't know. I hope they all do.
So, and I'm curious now, like, what is the association of even something like these medications predisposing those individuals to be higher at risk for SIBO and other serious digestive issues?
We're going to find out.
No one's really tracking this.
No one's tracking it. I mean, these kind of exploded, a year or two ago? I'm trying to think back when everybody was starting to talk about it and you couldn't get them and it was a big deal. And, now I think that some doctors are modulating their dosing to microdosing, and that might be a way to make this work so you're not muscle wasting. So maybe the digestive symptoms aren't as, intense. So I think that might be a way to go. But yeah, nobody's tracking it. And, we're going to see more of it. That's my prediction, is we're just going to see a lot more of it, more digestive issues and, associated conditions with it.
Yeah, I already see it myself. So, plus other issues that come along with it. I've noticed that mental health, because the absorption or the motility is not there. They're not getting all the nutrients in. They start to experience some mental health issues, whether it's anxiety or depression or low energy. Yeah.
And another fun fact about SIBO is that the gases produced by the fermentation when the bacteria eat damages the microvilli. So you get chronic SIBO cases have a lot of nutrient malabsorption, nutrient deficiencies. So think osteoporosis, think fat-soluble vitamins, think minerals, think water-soluble vitamins, think proteins. So they get really malnourished. Some people get really, really depleted from it. So that's why we need to treat it, besides just I have IBS, or they're long-term associations with chronic SIBO.
Yeah. So once someone heals from SIBO, are they healed completely, or do they have a risk in the future of it coming back, like reoccurring?
Well, 2/3 of people with SIBO get recurrence.
Really?
That's a statistic that we kind of know about. With some of these newer protocols, I'm seeing less recurrence because we put them on a maintenance plan, which helps keep their motility and their tissue stronger.
So they have to really make a lifestyle change.
Yeah, they do. I always hope that they can widen their diet so they're not in food jail. So, because that gets really tough for people. Yeah. And that's my aim with them, is to get them, they might not be able to go out and eat a gluten bagel, but
no hot dogs.
No hot dogs, but they'll be able to eat a healthy diet. And if they go out to eat, it's not going to, tear up their gut.
Yeah. What are some tips? Is there a way for us to avoid SIBO? Yeah.
Don't get food poisoning.
Don't get food poisoning. And if you do, get it treated right away.
Yeah. Try to avoid exposure to glyphosate, but that's impossible, right? Because it's in the air, it's in the water. People put it on their lawns. So is there a way to prevent it? I don't know. Don't get a traumatic brain injury. Make sure your thyroid levels are, it's like our modern lifestyle. We have all these things kind of bombarding us. Right?
Is it the thyroid function? Is it because, once again, it has so much to do with energy production, metabolism,
and motility?
So motility slows the gut. So anything that slows the gut motility will
Yeah.
compromise us to, and of course, food poisoning would compromise us
Right.
to
And if
developing
someone
that.
ever, gets has an abdominal surgery, C-section, appendix out, anything, hernia surgery, that, tummy tuck, whatever people do there, that's that's going to
Wow.
affect it too, because the scar, if it sets up scar tissue, it's going to affect motility again. It boils down a lot to keeping your motility healthy.
So what
So
Dr. Tara, yeah,
I don't know how to avoid it. Any of this
no,
stuff, just like,
not live.
not
Live.
live, right?
And that's the reality of our world, right? Is that
Yes.
we can do the best we can, but there's just
Hmm.
some things that can go wrong. And I think
Yes.
the key thing here is to find the right physician that can help you.
Hmm.
And it sounds like this is definitely your area of expertise, And so if our audience has been to many doctors, even natural and functional doctors, and they've not had any success, you might just want to give Dr. Tara a call to get some guidance and help there. What are some other things, or either it could be cases or something that you want to share with our audience on this particular topic?
Let me think. Some other things. Just that, the nutrient malabsorption that occurs long term is huge. When people's vitamin D goes low, it affects all the symptom
Yeah.
systems. Like it makes thyroid worse. It makes brain mental health worse. It makes your immune system worse. It makes cancer. So it increases risk of cancer. So all the things that go with nutrient
Yeah.
malabsorption are
Yeah.
huge. And often I'm undoing not only years of damage to the digestive system, but we're just trying to replete and replenish all those lost nutrients for
Yeah.
people. And that's part of the job working with SIBO too, not just like kill, 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 like the Western medicine
Yeah.
that here, take rifaximin, 2 weeks, see you later. They
Yeah.
don't work on motility, and then but then they don't work on all the other stuff, and you're still, it's not just, it's well beyond just the kill phase, which is what we were doing with all the antibiotics and antimicrobials.
That's right. You have to rebuild, repair,
Yeah.
the structures, the tissues, so that they
Hmm.
can go back to doing our work. I really hope that people understand how important gut health is. If your gut health is not well, it's going to impact every other system, because this is the
Everything.
way that we absorb the nutrients, which are all the building blocks, right? They're all the
Hmm.
building blocks to making
Hmm.
everything in our bodies function. So if we don't have the nutrients there, to build and repair and detox and make hormones and so forth, neurotransmitters, then something's
Yes,
going to be
all of it.
off. It is the machine
Absolutely.
that it's dispersing what needs to go where. And if that machine is not working, you're done. You're going to
It's the
struggle from
center
that
of the
point on.
universe, which is probably why I
Yes.
like working with it.
The
It's just,
center, and it is in the
it's
center
like,
of our body.
yeah, it's
Yeah.
like our interface with the outside world,
Yes.
you know, in their deep, it's not, beyond just the skin.
Yeah.
It's like how our inner being interfaces with our environment and the outside. So,
Yeah. And like you said, skin, we get a lot of people that are taking care of the outside of the skin. And as naturopaths, we know it's the gut, it's the liver. Like you have to work on that. If your diet is not clean, there's gut issues, liver congestion, it's going to show up on our skin. So it's not always about, let's put this stuff on my face. It's let's treat it from the inside out,
hey, I love a
too.
good facial,
Me
but
too. Yeah, I just had one this week. I'm like, oh wow.
oh, you're glowing.
But and that's it. The skin needs also a way to help, because it's a detox organ, so it needs to be
Yes.
able to, there's things that we need to do on our skin, whether it's dry brushing, a facial, getting some sun, things like that. That will help exfoliation of our skin. That'll help, that organ. Is there any unique case or a case that just really has stood out to you? Of course, you don't have to identify a patient, but just something that you saw, wow, this was impactful for this person as they were healing from this.
I currently have a child who is wheelchair bound, nonverbal, couldn't eat reacted to all sorts of foods, everything. So that it was on a very restricted diet. And we started just doing a very small amount of the formula that I use for the high dose sulfur. Like, I think this kid just can really tolerate a sprinkle.
Oh, wow.
And they're sleeping better. They're gaining weight. Now, this child will never be like walking and talking and, but they're growing. They're starting to thrive in a way they hadn't before. They're able to tolerate more foods. So I was like, we'll see how this works on somebody in this situation. But, it's great for the mother that the child is sleeping because the mother wasn't sleeping.
Yeah.
And you know what happens.
Yeah.
And I think this child is like 7 years old by now, something like that. So, so that was to me a pretty dramatic with just a little, we didn't even get up to what I thought the therapeutic dose would be.
Oh, wow.
And we're seeing changes. I'm like, just hold that dose. It's doing, their health is improving.
Yeah.
So
and
that's a dramatic case.
That is, because you just used very little and still saw some results there.
And I have other patients that I, did the whole antimicrobial thing with chronic constipation, bloating patients. And they, we were doing this antimicrobial, that antimicrobial. I was like, learning about how to use the sulfur. And I was like, let's try this. I was new to it. At this point, I've done, maybe hundreds of cases, but back then it was new. And this person like got relief like they never had, but like it moved the needle.
Oh, wow.
So super happy with some of these really chronic motility, constipated cases and how it works for that.
Amazing.
Yeah.
And as you said, you mentioned sleep, if you have digestive issues, it's going to affect our sleep because what percentage of melatonin is produced in our gut? Is it like 70, 80%?
I don't remember that statistic.
I remember but it's a good amount that our gut is producing some of those neurotransmitters, so it can have a huge impact on sleep and so forth.
And melatonin. Is also it's also prokinetic, so it helps with motility. So I love melatonin.
Yeah.
It doesn't always help people fall asleep. Like you don't always take it as a sleep aid, but it helps with it's an antioxidant. It helps with motility. It helps, suppress tumor growth. Does a lot of great things. So
it does do a lot of great things.
I love it.
It does. Yeah. Dr. Tara, what if individuals hear this episode, they want to reach out to you, they're interested in working with you, what's a good way for them to reach out and contact you?
My website. I think you have it somewhere.
Yeah. So to your website, is there a way to schedule on there?
There's a way to schedule a discovery call there.
Okay.
And then we get to see how we can work together.
Okay. So I'll make sure to link that in the notes of our show description to have your website, your contact information. And the best way is to go to Dr. Tara's website, schedule a discovery call with her, and, get to know her, get to see if she's the doctor for you. Do you work with people virtually as well?
I do. I only work virtually.
Oh, see? You only work virtually. So anybody can work with.
Since the pandemic, yes.
Yeah.
I started working more and more virtually. And then 2 years ago, I let go of my brick and mortar.
Okay.
So, yeah.
Dr. Tara, is there anything that you would like to share as we end this episode?
Oh, wow. Now just remember that the gut is the center of the universe. And if we can heal the gut, then a lot of other systems will improve.
Yeah. Maybe if we heal the gut, we'll have world peace.
Wouldn't that be amazing?
Wouldn't that be amazing? Everybody would just feel good and
everybody be happy.
Fix your gut, guys. Fix your gut. You need to come up. We need to come up with a shirt or a hat. Fix your gut.
Fix your gut.
I have a gut feeling you should fix your gut. There you go. Well, thank you so much, Dr. Tara, for joining me on this episode and for sharing your knowledge, your insight on SIBO, and hopefully our there's people out there that are struggling or they think they're struggling with this, that they'll
Yeah.
reach out to you. Thank you so much.
Great. Thank you.
Thank you. So to our audience, I thank you for joining us and listening or watching this episode with Dr. Tara on, as we discuss what SIBO is and how it can impact you. And if you're struggling with that, please make sure you reach out and go on her website, schedule a discovery call to see, if she's a good match for your gut to help you heal your gut. And
I also have a lot of blog posts up there, just a lot of other information if people just,
they want to learn. So make sure you check out her website. Yeah.
Yes, or join my email list. I send out emails a couple times a week. So all those things.
Okay.
So
stay connected.
Yeah. Stay connected.
So until next time, you guys be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raíces, visit our website at raicesndmedcenter.com. Until next time, be blessed.